Hello everyone. In this video, I will talk about the TNM staging of breast cancer. Make sure you watch this entire video till the end because in the end, I have discussed the entire staging through a very simple diagram which you can easily remember.
So if we look at the T staging, the first stage is TIS, which means cancer in situ. IS is in situ. And this includes DCIS and Paget's disease. So if the patient has DCIS or Paget's disease, it is TIS. T1 is when the size of the lump is less than or equal to 2 centimeters. So 2 centimeters is included here. Okay. T1 is a size of less than equal to 2 centimeters. T2 is a size between 2 to 5 centimeters. So if the size is anywhere between 2 to 5 centimeters, it is T2. T3 is a size of more than 5 centimeters. Now, if we look at stage T4, T4A is involvement of the chest wall. So the chest wall involvement is T4A, and the structures that this chest wall includes are the serratus anterior muscle, the ribs, and the intercostal muscles. This is what the chest wall includes: the serratus anterior, the ribs, and the intercostal muscles. Remember, pectorals are not involved in the chest wall. So if it says pectorals, it is not a part of chest wall involvement, and pectorals are not considered T4A stage. The next stage is T4B, which involves the skin. Now in skin, we could have satellite nodules or ulcerations, and all of that comes under skin involvement. T4C includes T4A plus T4B, meaning there is a chest wall involvement and there is a skin involvement. Both of these are involved in T4C. Finally, in T4D, it includes inflammatory breast cancer, and breast cancer is called inflammatory when more than 1/3 of the breast is involved. So this is one, inflammatory where more than 1/3 of the breast is involved. And the second condition is if there is a peau d'orange appearance, then also it is called a T4D. So if we look at this again, TIS is cancer in situ, which includes DCIS and Paget's. T1 is less than or equal to 2 centimeters. T2 is 2 to 5 centimeters. T3 is more than 5 centimeters. T4A is a chest wall involvement including the serratus anterior, the ribs, and the intercostals, not including the pectorals. T4B is skin involvement, which will have nodules and ulcerations. T4C is both chest wall and skin involvement. And T4B will be an inflammatory cancer where more than 1/3 of the breast is involved or a peau d'orange appearance. Now for the end staging, first of all, if we get confused about how many end stages are there, you can remember it very easily. N1 is going to have only one, a single stage. N2 is going to have two stages, N2A and N2B. And N3 is going to have three stages, N3A, N3B, and N3C. So this can be very easily remembered. N1 has one stage, N2 has two stages, and N3 has three stages. Now let's come to the staging. In N1, we have ipsilateral axillary lymph nodes, which means axillary lymph node enlargement will be there on the same side of the lump, and the lymph node will be mobile. So if you try to palpate it, it will be mobile, it will be movable. Whereas in N2A, again, the axillary lymph node of the same side is involved, but this time the lymph node is fixed. It will, if you try to move it, it will not move freely. Next, in N2B, internal mammary lymph node is involved on the same side. So axillary is not involved here. It's only the internal mammary lymph node that is involved. Now if we come to N3A, the infraclavicular lymph node is involved. In N3B, we have both internal mammary and axillary. And in N3C, we have supraclavicular lymph nodes. So if you see, it's sort of alternate. N2B is internal mammary. Then in N3A, we have infraclavicular. Then in N3B, we have internal mammary and axillary. And in N3C, we have supraclavicular. So you have to remember it as alternate. Next, the M stage, M0 will be no distant metastasis and M1 will be when distant metastasis is present. First, I'll explain this to you with this very simple diagram so you can imagine it in your mind when you start to write or answer any questions. So, if you look at the breast, the stage T1 will be a lump of size less than 2 centimeters. In T2, we have a size of 2 to 5 centimeters, and in T3, we have a size of more than 5 centimeters. So T1 less than 2, T2 2 to 5, and T3 more than 5. T4A is going to be chest wall involvement. If you look at this, this is a chest wall. T4A is going to be the chest wall involvement, and T4B is going to be involvement of the overlying skin. So if the overlying skin is involved, that is going to be T4B. T4C is going to be both chest wall and skin involvement. So it's going to be T4A plus T4B. That constitutes T4C. And T4D is when more than 1/3 of the breast is involved. That is T4D. So this is a sort of a diagrammatic representation of all of the T stages. T1 less than 2 centimeters, T2 2 to 5, T3 more than 5, T4A chest wall, T4B skin, T4C both chest wall and skin, and T4D more than 1/3. Now if we look at the nodal involvement, so these are the lymph nodes that are involved in breast cancer. We have the axillary lymph nodes, the internal mammary lymph nodes, infraclavicular and supraclavicular. Now the stage of N1 is going to be ipsilateral axillary lymph nodes, but they are mobile, so they can be moved when try to palpate it. N2A is going to be ipsilateral fixed axillary lymph nodes, which means when we try to move it, they will not be able to move it easily. So N1 is ipsilateral mobile, N2A is ipsilateral fixed, N2B is internal mammary, only internal mammary lymph nodes without axillary. So here in N2B, only internal mammary lymph nodes are involved, not axillary. Then in N3A, we have infraclavicular lymph nodes. In N3B, now we have both axillary and internal mammary lymph nodes. And finally, in N3C, we have the supraclavicular lymph nodes. This is how we do the nodal staging or at the end staging.